Hi, my name is Brittany Lake. I'm going to be presenting a quality improvement project on reducing no-show rates in the clinical setting. Let's get started. What is quality improvement? Quality improvement focuses on patient care, processes, and patient outcomes. The Center for Medicare and Medicaid tells us that quality improvement is a peer-based evaluation on improving patient care. It begins with recognizing problems that affect patients' care. Through analyses and interventions, these problems can be resolved by implementing new processes that will improve patients' outcomes. At Perkins Surgery Clinic, the problem identified is high no-show rates in 3 of the departments: ENT, orthopedics, and ophthalmology. High no-show rates is a problem because it disrupts clinic flow, causes delay in care, loss of revenue, and it can affect staff and patient satisfaction. This is a problem that may not be resolved 100%, but it can be improved to a lesser no-show percentage rate in these clinics. Now that the problem has been identified, we need to assess the potential reasons for the problem. Why are the no-show rates high? I started by looking at appointment reminders. Are the patients being called to remind them of their appointments, and are they confirming them? After looking at the policy, appointment confirmations begin 1 week prior to the patient's scheduled appointment. As you can see on the left side of the screen, this is the flow for patient confirmations. So if the patient confirms their appointment 1 week out, there's no further contact with the patient. If they are unable to be reached, they will be called again in 5 days before their appointment, and the same thing happens. If they confirm, no further contact. If they don't, they'll be called again 3 days, so on, up until the day before their appointment. In addition to the appointment confirmations, the clinical staff schedules the follow-up appointments at the end of their visit, as directed by the provider. The patient is sitting in the discharge lobby waiting on their after-visit summary while the clinical staff schedules their follow-up appointments. This chart on the right here shows the differences in scheduling appointments. In the clinic, the patient does not have an option for a date and a time because the clinical staff will just schedule them an appointment, and if that appointment date and time does not work for them, then they have to call centralized scheduling to get the day and time that works best for them. Here's the evidence of no-show rates from the months of March to August. The ENT department, which is the yellow line, had an average of 13 to 19%. Orthopedics clinic, the gray line, 5% to 13%. And the ophthalmology clinic, the red line, 9% to 14%. The no-show percentage rates have fluctuated in each clinic. Looking at appointment statistics, the fluctuation had a lot to do when the providers were out of the clinic more often in some months than others, which affects the appointments, how many appointments are actually scheduled in that month. That contributed to the increase in their no-show percentage, where it spikes up in certain months. The impact of no-shows is operational, financial, clinical, and morale of the staff. When there are a lot of no-shows, the providers start questioning where all of their patients are. It affects appointment availability. In specialty clinics, the next available appointment could be as far out as 3 weeks. Patients may have to go longer without their prescription refills or end up in the emergency room or even the hospital. When patients don't show up for their appointments, the company loses money because they're not being paid for services, but staff are still working and have to be paid. So there isn't money coming in to compensate for what's going out to pay the staff. At times, when clinic has low patient volume, staff have to be sent home because of the potential of revenue loss. All of this affects staff and patient satisfaction. In quality improvement projects, there needs to be an aim. Where do we want to see the progress of this problem? The goal set for Perkins Surgery Clinic by the organization is 10% for no-show rates. The aim for our no-show rates is to reduce our percentage by at least 1 to 2% each month over the next 6 months. By doing this, it projects that the departments will be at the 10% goal or maybe even less. Our plan is to meet the goal of 10% no-show percentage rates. This process is going to have to be changed, which includes confirming appointments no more than 3 days before the appointment. This gives close enough of a reminder that if a patient cannot come to their appointment, they can reschedule it at that time. Also, the clinical staff will start scheduling follow-up appointments face-to-face with the patient. So at the end of the patient's appointments, the clinical staff will go into the exam room with the patient to schedule the follow-up appointment so that the patient has options for dates and times. Here are the expectations for quality improvement. We want to improve patient access. By decreasing no-show rates, not only will we be in compliance with the 10% goal, but it will improve patient access as wait times will be reduced. This will also increase the number of patients seen in the clinic and allow more availability for other patients who need to be seen. We can increase continuity of care by preventing delays in care and medication treatments as patients consistently show up for appointments. There will be an increase in revenue and job stability due to an increase in reimbursement for more visits completed. All of this combined will increase the satisfaction of patients and staff. The evaluation part of the quality improvement project includes the clinic manager collecting data on no-show appointments in each clinic daily. This can be completed by running a report in the electronic health record system. Ours is Epic. At the end of the week, no-show appointments will be compared to the total number of appointments in each clinic. That's how the percentage will be found. The following week, the clinic manager will share this data with the staff and gather feedback from them on this new process that was implemented. What is working for them, what is not working for them, and make any changes as necessary. All staff will be responsible and held accountable for the change of the process, and the leader will also continue to encourage them to reach this 1% decrease of no-show rates each month. We want to see a 1% decrease each month to reach the goal of 10% or less no-show rates in 6 months. Here's a prediction of the results over the next 6 months. As you can see, the orthopedic and ophthalmology clinic should hit the goal of 10% in months 3 and 4, while ENT will likely take the whole 6 months. But this is a good indication that the quality improvement project has an appropriately set measurable goal. We recognized that no-show rates were high for each of the departments in the clinic, ENT, orthopedics, and ophthalmology. We looked at the current process for the appointment reminders and scheduling of follow-up appointments and found that there could be a better process. By implementing a new process to decrease no-show rates, we have a better chance at meeting the goal of 10% no-show rates each month. This goal is not just a number to achieve, but an increase in quality improvement for patient care, as well as staff and patient satisfaction.